Hello everyone, I'm Professor Lee of Dr. Wildlove TV. World's top 4 medicinal mushrooms with immunomodulatory and anti-cancer effect proven through clinical studies. Today is the last lecture part 2. Last time in part 1, we studied reishi mushroom and Schizophyllum commune. If you study just 2 more mushrooms today, you are not a beginner in knowledge and use of medicinal mushrooms. Let's get started. This is the third mushroom. It's an annual mushroom that grows from summer to fall. The surface of the color of the cap is diverse, including black, dark brown, yellow-brown, reddish-brown, yellow, and white. A polysaccharide called PSK is famous for its immunomodulatory and anti-cancer effect. Additionally, it's been proven to be effective in improving symptoms of autoimmune disease, rheumatoid arthritis, multiple sclerosis, chronic obstructive pulmonary disease, and asthma. What's the name of these mushrooms? It is turkey tail mushroom, and its Korean name is cloud mushroom because it looks like a cloud. Wow, it's amazing, right? This is a guy I met at high mountain in early fall. Tens of thousands of mushrooms are attached to dead trees, and they are working hard to return dead trees to nature. It is a 1-year-old mushroom of the Polyphoraceae family. The scientific name is Trameris versicolor. They occur in clusters on fallen trees, stumps, dead trees from early summer to fall. The surface of the cap is 1 to 5 cm in diameter, 1 to 2 cm thick, and is fan-shaped or semicircular. The color is close to black. It has a ring pattern and short, dense hair that looks like a carpet when touched. The edges of the cap are white when young and gradually turn gray-brown as they age. The typical color of the cap surface is black, and the edge of the cap is white. The white edge of the cap gradually turns grayish-brown as it ages. It has various colors other than black. The color of this is dark brown. It is gray mixed with red. The color of the surface of this is yellow mixed with white. This is yellowish-brown, right? And this is grayish-brown. The underside of the cap is initially white, gray mixed with white or yellow, and gradually turns yellow-brown as it ages. If you look closely, you can see tiny pores. The underside of the cap gradually turns yellow-brown as it ages. When it is dry or in winter, it dries out and shrivels. When you cut the cap, the tissue is tough and fibrous and is white or milky white. The main active ingredient is a polysaccharide protein with proven immunomodulatory and anti-cancer effect. The most common active ingredient in other mushrooms is beta-glucan, a polysaccharide, but in turkey tail mushroom, a combination of polysaccharide and protein, such as polysaccharide peptide, PSP, and polysaccharide creatine, PSK, are the main active component. I'll tell you the result of the clinical study. There's a lot of research on PSK and PSP. 1. To summarize the result of 23 papers, the survival rate increased and the recurrence rate decreased when used in combination with standard cancer treatment. After taking 3 grams of polysaccharide powder per day in 262 stomach cancer patients, 5-year survival rate increased and recurrence rate decreased. In 9 breast cancer patients, after taking 3 grams, 6 grams, and 9 grams of polysaccharide powder per day, the number of lymphocytes decreased after radiation treatment returned to normal, and NK cell activity doubled. 34 patients with terminal lung cancer took 315 mg of polysaccharide powder 3 times a day for 4 weeks, increased white blood cell count. In 186 colon cancer patients, the side effects of chemotherapy were reduced. Second, the effectiveness of removing oral human papillomavirus is 88%. Third, in a patient with cervical human papilloma, a gel made from mushroom extract was applied to the vagina, and the virus disappearance rate was 60% after 6 months. The scent has a mild earthy, slightly moldy scent. The taste is mild bitter or astringent. When you search the internet, there are lots of capsules, tablets, powders, tea products. The degree of extract concentration varies depending on the product, so after get it, take as recommended. You should start with the smallest amount. This is the powder tea method. 1. When taking polysaccharide extract in a freeze-dried powder form, 6 to 15 grams per day. The most common dose used in clinical studies is 3 to 6 grams per day. 2. 1 to 2 teaspoons of dry powder. Pour 250 cc of boiling water. Let it for 5 to 10 minutes, and then take it like tea 2 to 3 times a day. Traditional decoction tea method is very good. 1. Harvest it all year round. If there is a lot of moisture, it sticks to the bark and it's difficult to collect, so collect slightly dried ones and put them in a net to ensure good ventilation and dry in the shade. 2. It's too dry in winter, so it's better to collect in spring and fall. 3. Daily dose of 10 to 30 grams. 10 grams is recommended to start. Add 1 liter of water, and when the water starts to boil, turn the heat to low and boil until half. Usually, it takes about 2 hours. In traditional medicine, it's used to improve immunity, chronic hepatitis B, chronic bronchitis, and leukemia. Let me tell you about the side effect. 1. Stop the allergy first and visit the hospital if it is severe. People allergic to mushrooms should be especially careful. 2. If you have gastrointestinal problems such as heartburn, diarrhea, nausea, constipation, or palpitations, stop taking it for 2 to 3 days and then start again with a smaller dose. 3. If symptoms of autoimmune disease, rheumatoid arthritis, lupus, etc. worsen due to immune activation, stop taking it. This is a precautions. 1. Pregnant women and breastfeeding should avoid. 2. Consult your doctor if you are taking anticoagulant, antiplatelet agent, or immunosuppressant. In addition to immune activation and anti-cancer effect, it has other proven effects. 1. Improvement of symptoms of autoimmune disease, such as rheumatism, multiple sclerosis, etc. 2. Improvement of chronic obstructive pulmonary disease and asthma symptoms. 3. Reduce intestinal flora imbalance caused by antibiotics. Anyone who loves mountains have probably seen this mushroom at least once. At one time, it was briefly introduced in the media, and people who saw it on the mountains gathered there. But these days, it's a forgotten mushroom. Now, Dr. Wildherb TV subscribers have learned that this is an important mushroom with valuable benefits. When you go to the mountains and see them, don't ignore them just because they are common, but get closer and take a closer look. This is the fourth mushroom. It's a dark brown to yellow-brown hard woody mushroom. Clinical studies have reported the activation of immune cells, especially NK cells. Although there are still few clinical studies, anti-aging, anti-cancer, liver protection, and anti-diabetic properties been reported in animal studies. What's the name of this mushroom? The scientific name of this mushroom is Tropicophoros linteus, and its previous name is Phalaenus linteus. There are 2 types of Tropicophoros linteus. First, there are 2 species of Sanghwangphoros in Korea. 1. Sanghwangphoros sanghwang that occurs on mulberry tree. 2. Sanghwangphoros baumi that grows on coniferous trees such as pineapple. The second is Tropicophoros linteus, which occurs on a variety of broadleaf trees and is distributed not only in temperate regions but also in tropical and subtropical regions. When distributed domestically, this is also called sanghwang mushroom. The surface of the cap is dark brown, hardwood texture, and the edge of the cap are yellow-brown. It looks as if the mud has dried and hardened like wood, so the Korean name is woody mud mushroom. The cap shape is semicircular or horseshoe shape and is 5 to 15 cm wide. The edge of the cap is pale yellow in the early stage of growth. As it grows, the edge of the cap turns from yellow to yellow-brown. The thickness is about 2 to 10 cm, and the one you see now are called flat type. This is a cross-sectional view of the mushroom tissue. It's quite thick, right? The color is yellow or yellow-brown. The main active ingredients are 1. Beta-glucan, a polysaccharide with proven immunomodulatory and anti-cancer effect, and 2. Histidine, tritopenoid, phenol, rectin, etc. Clinical research is still lacking. In a small number of clinical studies, 1,000 mg twice a day for 8 weeks, NK cell activity was significantly increased. This mushroom have no specific scent. The taste is light, with only a slightly bitter finish. When you search the internet, there are lots of capsules, tablets, powders, and tea products. The degree of extract concentration varies depending on the product. If to get it, take as recommended. You start with the smallest amount. For powder tea, pour 1 to 2 teaspoons of dry powder, 3 to 5 grams per day, and 250 cc of water. Boil it for 5 to 10 minutes and take it like tea 2 to 3 times a day. This is a traditional decoction tea method. The daily dose is 3 to 5 grams, and it is convenient to make it for 10 days at a time. Add 30 to 50 grams of finely chopped mushroom, starting from 30 grams, to 2 liters of water. When the water starts to boil, reduce the heat to low and boil until the water volume is reduced by half. Empty 1 liter of boiled water into another container. Add 2 liters of bottled water and repeat. This is a 10-day supply of tea. Store it in the refrigerator and take it 2 to 3 times a day like tea. In traditional medicine, it's used for immune activation, anti-cancer, longevity, anti-inflammatory, such as arthritis, gastritis, etc., cardiovascular disease, and hyperlipidemia. Let me tell you about the side effect. 1. Stop the allergy first and visit the hospital if it is severe. People allergic to mushrooms should be especially careful. 2. For gastrointestinal problems such as diarrhea, nausea, stop taking it for 2 to 3 days and start again with a small amount. 3. If the symptoms of autoimmune disease such as rheumatoid arthritis, lupus, etc. worsen due to immune activation, you should stop taking it. This is your precautions. 1. Pregnant women and breastfeeding should avoid. 2. Consult your doctor if you are taking anticoagulant, antiplatelet drugs, or immunosuppressant. As for other proven effects, there are still few clinical studies. However, anti-aging, anti-cancer, liver protection, and anti-diabetic pharmacological effect have been proven. In addition to top 4, the 2 mushrooms that have not yet been explained due to lack of clinical research are chaga mushrooms and Formis frumentarius. However, these 2 medicinal mushrooms have been proven effective in animal studies and are also sold as health food product. This is the end of the lecture on top 4 medicinal mushrooms. At this level, you probably know a lot about immunomodulatory and anti-cancer medicinal mushrooms. Thank you all for your hard work. The following lecture is a world top 5 edible mushrooms with proven immune modulating and anti-cancer effect. You should study not only medicinal mushrooms but also edible mushroom, right? Stay healthy everyone until we see you again.